Before beginning the whitening treatment, a comprehensive exam and cleaning must be performed to ensure dental health. For full pre-treatment procedures and precautions, refer to the instructions for use. Fabricate custom trays for your patient and review the following instructions together. Remove the cap from a whitening gel syringe. Express one continuous bead of gel inside each tray. This should use 1/3 to 1/2 of a syringe per tray. If gel remains in the syringe, you can reseal it using the opposite end of the breakaway cap. Gently press the trays into place. If there is excess gel pushed out of the trays by pressing too firmly or overfilling, remove it with a soft toothbrush. Wear the trays for the recommended time or as instructed by your clinician. After the prescribed wear time has passed, remove the trays. Brush the remaining gel from your teeth and rinse. Do not swallow rinsed gel. Clean the trays with water and a soft toothbrush after each use and store them in a clean, dry container. Wait 7 to 10 days after whitening procedures before placing adhesive restorations. See the IFU for complete instructions. If you have any questions regarding the appropriate use of this product, including how long it will take to whiten your teeth, please consult your dentist.